All right, good afternoon, everyone. My name is Venton Hill Jones, and I am the Chief Executive Officer of the Southern Black Policy and Advocacy Network. And welcome to the AIDSWatch 2020 session, Southern Black Communities and the Ending the Epidemic Initiative. So I'm going to put on a slide presentation that I'm going to share to help guide our conversation today. All right. All right, wonderful. So first, before we get started, just want to express my appreciation to the conveners of AIDSWatch, AIDS United, for continuing this very important conversation around ending the HIV/AIDS epidemic. I know that there's so much going on with the coronavirus pandemic that we're dealing with right now. But it's definitely wonderful to be able to have the opportunity to continue to advance the very important work that we are all doing to end the HIV/AIDS epidemic. So again, my name is Venton Hill Jones, and I am the Chief Executive Officer of the Southern Black Policy and Advocacy Network. And while everybody's online, here are some opportunities to be able to connect with the Southern Black Policy and Advocacy Network, our website, our email, as well as our social media handles. And what I would like to do is just take an opportunity. I see that there are a lot of people who are engaged in the chat function. I just wanted to just really have a formal time to get to know everyone in the virtual meeting space. And if you could just share your name, what state you're located in today, and also what organization you're coming from that you work with. And I'm looking at the chat function and just want to see, hopefully if we were online, we would have had a introduction, but again, just love to see who's in the room today. All right, Torian, Nathan, Kendall Clark. All right, Thrive SS in Atlanta, Jesse, all right. Daniel, all right. So we're seeing a lot of Southern states, so it's great to see participation of leaders in the South. There we go, all right. Max Boykin. All right, Texas, North Carolina, wonderful. San Francisco, Alabama, Georgia, all right, wonderful, wonderful, wonderful. We'll keep those coming in. Wonderful to see that there is so much participation from those of you who are living in the South. So hopefully we have this conversation. This will be very relevant to what you're experiencing in the work in your local community. So jumping back to our presentation. All right, great. All right, so the Southern Black Policy and Advocacy Network was established in 2018. Our work is focused on improving health outcomes and reducing social and economic disparities impacting Black communities in the South, as well as the Southern Black Policy and Advocacy Network is a Black Indigenous health policy and advocacy organization headquartered in Dallas, Texas. And what is the South? The South, as defined by the United States Census Bureau, includes 16 states and Washington, D.C. So the South is actually broken up into 3 jurisdictions, the West, South, Central, East, South, Central, as well as the South Atlantic. All right, and part of our impact, the Southern Black Policy and Advocacy Network, we aim to organize and build the capacity of Black communities to impact federal, state, and local health equity and policy and advocacy efforts that will create systematic and meaningful changes for Black communities in the U.S. South. Our framework is modeled on information dissemination, community organizing, as well as mobilization and issue advocacy, which will result in measurable improved health outcomes for Black communities living in the South. Our priorities: strengthening the capacity of Black communities to engage in federal, state, and local policy programs and research, expand the Black policy and advocacy leadership pipeline in the South, as well as enhance the collection and analysis of data to inform solutions for addressing health outcomes for Black communities in the South, as well as improve information dissemination of health policy and advocacy among Black communities living in the South. And here, one of our key initiatives when we formed as an organization, just understanding the importance of addressing the HIV/AIDS epidemic for Black communities in the South, we formed the Southern Black HIV/AIDS Network, which formed its first campaign, which is organizing to end Black HIV now. And so in 2019, the Southern Black Policy and Advocacy Network engaged in a number of activities to help mobilize and organize Black communities around addressing the HIV/AIDS epidemic. And part of the effort was organizing our 2019 Southern Black HIV/AIDS Network Advisory Council. And these leaders make up some of the top Black leaders in the South addressing HIV and AIDS for a diverse population of Black communities. And part of the work, what we wanted to do with the Southern Black HIV/AIDS Network was really bring together those leaders so that we are talking about HIV from a Black perspective, a Southern Black perspective. And sometimes when we talk about HIV work, it's usually siloed in conversations that are about sub-demographics of Black communities. And we really wanted to focus this conversation on Black communities in the South, as well as having a very focused conversation about the workforce working to address HIV in the South. And so another one of our initiatives in 2019, we prepared and released in 2020 our HIV advocacy assessment needs assessment. And this assessment was designed to address gaps in knowledge regarding the current capacity of HIV/AIDS advocacy in Black communities in the South. And this needs assessment was intended to expand the capacity of HIV leaders and advocates to impact HIV policies, programs, and research on behalf of diverse populations of Black communities in 9 targeted states, which you can see on the slide. And this assessment provided some key recommendations, and we were able to create this process through one, engagement with our advocacy advisory council, but also we conducted a needs assessment in 2019 to poll those working on the front lines of addressing HIV. And through that, we came up with 5 key recommendations. One, the importance of the expansion, policy recommendations around the expansion of Medicaid, particularly in Louisiana, where Medicaid expansion was already granted, sustain it. But for the rest of the southern states, Medicaid has not been expanded yet. Ensure the meaningful participation of Black communities in the development, implementation, and monitoring of the federal initiative to end the HIV/AIDS epidemic by 2030, ending the epidemic. So making sure that when we have conversations about Black communities and ending the HIV/AIDS epidemic, that we just don't stop at the consumer level. How do we talk about meaningful engagement of Black communities as staff members, as leaders, as those who are at the forefront and should be at the table of guiding efforts for ending the epidemic, and not just as end consumers of HIV testing and care services. Also, expand the coverage and access to pre-exposure prophylaxis to prevent HIV, the widespread expansion of syringe services programs, and addressing social determinants of health for Black communities in the South. And so one thing that we cannot ignore in this current moment is the COVID pandemic right now and its impact on ending the epidemic efforts. And so we know from COVID-19, that's why we're here in a virtual environment for AIDSWatch. It's why all of us are participating primarily from our homes. And as well as when we think about the end of the epidemic plan right now, we have to start to anticipate some of the delays that are occurring because of the COVID-19 pandemic. And so with some of the recommendations, I think we really have to understand that we're still getting analysis of how COVID is impacting the country right now, and also getting a very clear understanding of how that impacts the future momentum of the End of the Epidemic initiative. And so as we talk about the End of the Epidemic Initiative, just really brief, we had this discussion this morning. It's HHS goal to reduce new HIV infections by 75% in the next 5 years and by 90% in the next 10 years, avoiding more than 250,000 HIV infections in this span. And then as well as the United States South represents 20 counties and 6 states and the District of Columbia in this plan. And so what's very important with the End of the Epidemic work is that noticing that 24 counties are within the South, as well as all states are southern states, as far as it's, this End of the Epidemic response to the Southern epidemic. So I think it's very important that we realize that strategies have to be focused on the South, as well as focused on key populations that represents the Southern HIV/AIDS epidemic. And so in 2017, the Black community accounted for 53% of all new HIV diagnoses in the South, despite only accounting for 19% of the Southern population. So when we talk about the End of the Epidemic Initiative, we have to be very clear that solutions have to be very tailored and focused on the needs of Black communities and serving diverse populations of Black communities throughout the South. And so what we heard this morning from Harold Phillips from HHS was that the most recent funding announcement that was provided by, from the CDC, RFP 2010, the deadline for submissions for that grant has been extended to May the 1st. There are a number of efforts that are also going on as far as the review of the draft End of the Epidemic plans that may be impacted, but we know that the federal government are reviewing current local End of the Epidemic plans in order to provide that feedback to states. And what we want to do, and hopefully have a conversation a little bit later on in the presentation, is to learn what's going on with your local End of the Epidemic work. So definitely I'm able to see the conversations now, so love the engagement that's been going on all day. And hopefully we'll have a great conversation about that work, because I think that for so many of us who are following End of the Epidemic work, the best information is really coming from those who are involved on the ground, seeing the work happen in their local communities. And so what we're still seeing is some challenges with End of the Epidemic work through our involvement with the Southern Black HIV/AIDS Network. We're noticing that many communities and HIV leaders in Southern EHE jurisdictions have not seen the draft EHE plan submitted to the CDC by December 31st, 2019. Also, state and local health departments continue to share very little about the grant design for the CDC and HRSA funding to begin End of the Epidemic planning. And so I think it's very important, and this is really going to be depending on where you reside, because in some places the sharing of information is different in other places. And hopefully, again, we can use the chat function to see what's happening in your local community. But also, as we talk about this the AIDSWatch right now, and really talking to elected officials, even some of our allies in Congress now know very little about the End of the Epidemic work. So how do we make sure to provide information to those individuals and elected officials, those who are before us and all those who are still needing some persuading to champion this work, to know about the End of the Epidemic initiative and how to engage in the work on a local level. And then there's also a lack of shared understanding of effective community engagement in End of the Epidemic efforts. Depending upon the health department that you ask, would sometimes be a very different answer around what does meaningful community engagement look like. And I think that it's very important to share that in order for us to really understand and really have a clear conversation about community engagement, we really have to have a shared understanding of what does that language mean and how do we move forward in meaningfully involving community in the work to end the HIV/AIDS epidemic. Opportunities for the End of the Epidemic work. Health departments have submitted their draft EHE plans. So now is the opportunity to ask that the draft plans be shared with the community. Many EHE local jurisdictions have shared both plans with the CDC as well as state health departments. So hopefully, if you have not already, request that those plans be shared with you in order to be able to start giving feedback, as CDC is also preparing their feedback. It's also, there's an opportunity to join local HIV task force and Ryan White planning councils. These groups have been identified and charged with working with health departments to improve in the epidemic community engagement. So those are bodies that, one, the Ryan White Planning Council is mandated by HRSA in order to improve community engagement and the allocation of resources, or Ryan White resources, and then many local jurisdictions through such initiatives such as Fast Track Cities, such as Getting to Zero, and a number of other initiatives have formed local in the epidemic task force in order to engage in community engagement. So be on the lookout for those groups, join those groups, and hopefully get into leadership and make sure that your voice is heard with in the epidemic work in local jurisdictions. And then also determine when will EHE community planning meetings be rescheduled due to COVID-19. So we know right now in this moment that a number of meetings are being rescheduled, including local meetings for ending the epidemic. Don't wait till the health department contacts you. Be proactive in reaching out to the health department, reaching out to community leaders who may be leading planning councils or leading task force, and ask, when will these meetings continue in order to continue the very important conversation around addressing HIV. Just like AIDSWatch, many meetings are being transitioned to platforms like Zoom, like WebEx, in order to continue dialogue and continue the needed momentum to inform in the epidemic work, and continue to hopefully move us forward to submitting final in the epidemic plans towards the end of this year. And so what I want to take the opportunity to do, and this may, hopefully we can kind of engage in a conversation that this was primarily engaged for in person, but looking at the virtual environment, maybe we can see how to kind of break down one question at a time. But maybe each of you, if you live in an EHE jurisdiction, in your chat box, please share what jurisdiction you live in. And if you're in a state, identify the rural state. If you are in a local jurisdiction, please identify which local jurisdiction that you are a part of. So I'll get us started. So we're seeing Los Angeles, Dallas, Baltimore, Fulton County, DeKalb, Houston, Texas, Broward County, Charlotte, North Carolina, Atlanta. Let's see. And I'm actually seeing the conversation that's going on about planning councils, and actually maybe we can kind of get into a conversation about that. So, wish we could use some more of the voice function, but it's looking like the chat function is really going to have to be how we really work to have this conversation. So as we talk about this, let's go to our next question as people are still entering in their EHE jurisdictions. What are your local mechanisms for EHE community engagement? So that may be task force, that may be planning councils. What has been the work that you have seen in your local county to move engagement? I think that this is a very important piece around the challenge that was brought up in the chat around how these bodies meet. So thinking about, is the time of day, how are we meeting? Usually these planning council meetings either happen in the morning or during the day when most people are working. So really thinking about how do these bodies work, and maybe we can provide some recommendations towards the end of this Q&A about how do we improve those things, because we have to, in this moment, figure out how do we make these systems work to make sure we can maximize community involvement and engagement. So the next question was, what are your local mechanisms for EHE community engagement? So we're seeing some Getting to Zero task force in where we're located, Dallas County. We have the Dallas County HIV Task Force and also the Dallas County Ryan White Planning Council. So Georgia, there's a planning council for Part A. Department of Public Health have prevention and care in addition to metro-wide groups. There are EHE community meetings in the evenings, virtual meetings, and targeted focused conversations. And maybe even as we talk about ending the epidemic and this moment that we're in with COVID-19, how with all of us being home, the opportunity for these meetings to really become a part of the living room conversation. And how do we use this opportunity to really go deep? And even now we're noticing with AIDSWatch, which has its highest level of participation, because it's in the past there was just the on the ground conversation, and then there were some live opportunities, but now many of these local groups are now having to move to virtual engagements that hopefully will encourage the participation of more than who could just come in the past. And so way too often the planning bodies are not set up to get community engagement. They are set up to get the engagement of those in HIV professional industry. More has to be done to expand off hours meetings. Absolutely. And what actually, I think that was Justin who mentioned that in Atlanta that there are meetings that are now happening in the evenings. I can also share what's something that I've also seen in Dallas County, to where sometimes some meetings that take place are actually repeated in the evening. So if there was a meeting that happened, on one day from 1 to 3, that meeting the next day will be repeated from 6 to 9 to be able to help accommodate those who may not be able to make it. We cannot function in the manner which has put us where we are now and expect different results. Absolutely. So having many conversations about going where the people are. So one thing I really want to ask, and as we talk about going where people are, I think we have to ask the very important conversation and have this conversation as far as the people who are working in the field and those who are interested in the advocacy work. How many of you have actually seen your draft ending the epidemic plans that were submitted in December 31st? So we've seen it in Broward. Parts of the plan has been seen in Baltimore. So great. It's great to see now at this point that more individuals are seeing and helping to write local plans, because there was a challenge at an earlier point when plans were submitted that was not happening. So it's great to see that more of you who are participating have seen the plans. Maybe we can see how many of you have not seen the plans. Maybe you can enter no and where are you located? I have asked for many plans on the state level and we're not getting it. So no, Alabama, no, New York. So there's someone who actually said no, Fulton County. So interestingly enough, there are some people that in Fulton County have seen their plans. And so my question to the people who are on from Fulton County, how can people who are not connected to that get access to be able to see the work that's happening in Fulton County? I saw Derek there and Justin who's in Fulton County. So we no in Atlanta, no Alabama. I'm sorry, Alabama. Forest County. And definitely take note of the people who you are seeing in the comments. These are some dynamic leaders who are leading in the epidemic work. Daniel Driven, Max Boykin, who continue this work. Justin Smith, who's on the Presidential Advisory Council. These are individuals who are in the South, who are doing the work around in the epidemic and really following and monitoring the policies around this. So asking for a meeting with health departments, what's happened? And maybe we can, use this conversation to go into, oh, also just as a note, make sure when you are commenting, you use the chat function, all panelists and attendees, so that everyone could be able to see and engage your comments. Usually with some webinars, we've usually had the opportunity to have some voice interaction, but with this platform, our interaction is with chat. So make sure that you're sharing with everyone, because really the importance of this opportunity is really building platforms so that leaders can be able to have a conversation about the end of the epidemic work. So let's go into, they need to actually listen to the input, amen. So let's go into our last question that we have. And that question is, what should health departments be doing to improve in the epidemic community engagement? So when guidance was placed for the funding to create the local end of the epidemic plans through PS 1906, community engagement was really explained very broadly. And so maybe we can think about some key recommendations that health departments should be utilizing in order to help improve community engagement, particularly to Southern jurisdictions and their end of the epidemic work. So, and hey, Cedric. So there was a question that came up in a session, what can be done in the South to help stop the transmission of HIV? One thing that really has to be talked about is how to make sure that messaging around key initiatives are reaching a critical mass of leaders and communities, particularly as it relates to U=U in the epidemic work. Treatment as prevention, some of those things are still very foreign concepts to community. And so how do we make sure to create the opportunities for people to engage in understanding what do those initiatives mean for community? Because so often we talk about the science behind the work, but we don't necessarily talk about the true implications of how to get that work done. So a major conversation that we need to have is around stigma that still exists within HIV work that prevents those individuals from community to even walk into the doors of our health departments. How do we still address racism and homophobia that exists within the workforce, the public health workforce, that doesn't allow community to be put into positions of leadership within the work? How do we focus on the needed workforce development work that's needed to really help build the capacity of people living with HIV to be able to continue to do this work in a long-term substantive fashion, not just to disclose HIV status, and also making sure that in the epidemic work, we're talking about the needs of community, not just from a perspective of getting tested and treated, but really from a perspective of understanding the whole person or the whole community. All right, stop using stigma as a catch-all term, which is multi-layered depending upon your community. Stop just focusing on biomedical. And Forbes has asked to see the plans and have not been allowed to. Would it do any good to go public with that? I think that it would be, because I mean, I think that there are a number of And what you bring up a very important point. There are a number of different initiatives, organizations, and individuals asking for ending the epidemic plans, and those plans are not being shared. And so how can community be involved if community are not a part of the plans that are being created? Public health cannot be done in a silo. All right, again, just make sure that as we're engaging in the conversation that you are selecting the all panelists and attendees in the chat function so that everyone can make sure to see the chat box. And so again, we're asking one of the questions, what should health departments be doing to improve ending the epidemic community engagement? And so one of the key questions, and I believe that it was asked by Carl Bologna this morning to HHS, is how do we expand the understanding of community engagement really just past what was provided in the PS 1906 guidance, which really just stated community engagement will be measured by the collection of sign-in sheets and meeting rosters for planning bodies. How do we make sure that when we have the conversation about people living with HIV, that we are incorporating people living with HIV at all levels, whether they be a volunteer, whether they be a consumer of services, whether they be a person who's doing the work and leading the work that in local communities, like many of you who are participating in the conversation. Don't leave out youth and older folks. Feel that I see the same age groups in terms of engagement. Do you want to share a little bit more about that, as far as what age groups do you see in that engagement? And maybe you can share with us, how do we really involve diverse communities like younger individuals and those who are over the age of 55 in the Ending the Epidemic work? One recommendation came through that said local HHS and round-wide planning councils need to allow the development of one plan and not two plans, integrated plan and EHE work. EHE plan. Workforce needs to be educated to change the vision of the work. Totally agree with you. What we've noticed is that many communities are having to build multiple strategies at one time. So I use Dallas County for an example, who has our current integrated plan in place, a state strategy for addressing HIV, which is called Achieving Together, fast track cities work, as well as ending the epidemic work. So really, how does that work really align in order to really crystallize into one strategy for each of the jurisdictions? So part of the DC Commission on it, we met last week via Zoom. So what we're also seeing is that planning bodies are also starting to, in this kind of COVID-19 reality, we're seeing planning councils like the DC Commission on Health and HIV starting to meet via Zoom. Let's see, I often see folks 25 to 50, youth and older folks need to be specifically engaged and invited to planning committees and events. I found that going directly to the events and paying them for their expertise work. So really, how do we bring community to the table to invite and be at the meetings, but also to be compensated for their expertise? So this really brings in a conversation about the workforce. And I was so glad to really hear this increased conversation on the workforce, because we just can't bring community to the table to volunteer expertise. We have to really create opportunities that provides compensation and ways for people to be sustained to be at these leadership tables, especially when we engage in processes for multi-year endeavors like the Ending the Epidemic plan. Expanded community engagement outside of local health departments' doors, meeting the communities where they are, status neutral. We will never get to zero until we focus on reaching the hard to reach populations and folks and those out of care. Absolutely right. And so we have to Yes, meeting people where they are. So maybe we can just look at that. So what is that, especially when we talk about, and let me kind of focus this conversation again, when we talk about Black communities in the South, what does it mean to meet Black communities where they are when we talk about these meetings? There could be, what are the recommendations around how do we make that happen so that really the people who are in the chat can really see these thoughts when we have a very focused conversation about Black communities? Is that having opportunities to meet at night? Is that having opportunities to bring this work to local Black CBOs to do the work? What does that look like as far as meeting Black communities in the South where they are and ending the epidemic work? I'm just learning the details about EHE. I'm trying to gain access and connections to more information and networking. I'm working in the lower level of HIV as a community health worker and advocating for 3 years. I want to grow more engaged. Maybe you can send a message to myself and also some of the leaders here with AIDS United, and we can really find out ways to get you involved, particularly in your local jurisdiction, because you know, in this work, you know, we really have to make sure that we're understanding how to really involve in this mechanism called ending the epidemic work in local communities. To meet them where they are, I would start off with having some community meetings or live social media chats and asking what are their main health needs and adding to the HIV prevention conversation to really bring some state health department to those social determinants of health needs. Thank you very much. All right, so you have to get there. We must be put a lot of, let's see, we must put a lot of money into travel transportation because there are in the North, we are close to our medical providers. In the South, there are limited public transportations, must be vans to reimburse with the travel to engage. Absolutely. So finding mechanisms to really encourage ways to involve and encourage methods to find transportation to care sites, and that in a consistent way. Historically, churches have been the seat of social justice in the Black community. Absolutely, I totally agree with the church being that seat of social justice. But how do we also identify other seats that really have to be engaged in addition to faith communities, especially when we talk about reaching diverse populations of Black communities in the South? Someone said that they cannot see. Can you still see? Hold on. Okay, good. All right, so back to the chat. Expanded community, let's see. All right, y'all are hitting me up everywhere right now. All right. Engagement of HBCUs, so engaging Black communities in the South at HBCUs. All right. All right, so we provided, there has been a lot of recommendations that have been provided around better recruitment for new planning council members, a great place for engagement. One thing I will say about planning councils is, I don't know about you, but in most of the planning councils I've seen, there tend to be a lot of meetings. So whether it be the meeting of the planning council or the meeting of the committees of the planning councils, there seem to be a lot of meetings. And so how do you really make that, how do you make sure that communities can continue to be engaged with the body like the planning council when it meets so frequently, especially when you talk about people who are not able to who are not working in the field, to be quite honest, and but are expected to be in these conversations with planning councils. And oftentimes, you know, the work has to continue to go on, but we're still not able to make sure that communities at the table in a meaningful way. You may get that meeting, you know, at the beginning of the month, but again, I think that the conversation really has to be, how do we increase this dialogue around meaningful engagement of key impacted populations in HIV, particularly Black communities in the South, to be consistently brought to the table and really put into a consistent leadership role or a consistent participant role in this work. We still have about 6 months until and then the epidemic plans are submitted, final plans are submitted, and that may be extended due to COVID-19. Too many meetings of planning councils run people off while they're not employed by HIV organizations. Daniel said HBCUs are great if they want to be involved, but also they are inflicting trauma to the people we are trying to reach, especially gay, bisexual, and same gender loving men. In the city of Newark, our community involvement meets every month, and let's see what you really get the community involved. We must share methods. So what are some of those methods that happen in New York, in Newark, that really improves community engagement? So engagement of Black social and civic clubs, bike, car clubs, etc. Absolutely. There's no time for formal conversations and explanations. Councils are on a time schedule, yes. Reaching out to Black ladies that are HIV and that are living with HIV, that have teenagers living in the communities that are willing to speak out about HIV. Absolutely. And so one of the conversations around disclosure is, how do we make sure that communities in the South are safe for people to disclose in? Because we have this message and we have this conversation going on around disclosure, but how do we make sure that those young girls or those young Black boys can be able to disclose? And there are programs that are created in those communities to be able to support that kind of work. When we talk about the needs of young people, so often the work to engage young people don't really start until that young person is 18. So if we're talking about Black communities having a younger sexual debut, becoming HIV positive at a younger age, how do we make sure that programs are serving those young people at that age versus us going around those young people and them developing, could possibly be up to a decade of sexual behavior that has to be deconstructed by the age of 18. That just seems like that's just not a very good proposal of engaging our young people. Maybe having testing outside of Black clubs and bars. A question that came up is any success stories on reaching out to HBCUs with administration so that prevention can increase on their campus. Maybe someone could respond to that. I know there have been a number of HBCU initiatives that has taken place to really help engage administrators around sexual health on those campuses. And I think that that's definitely important for the South. And how do we use, Southern HBCU experiences and weekends and games as an opportunity to increase knowledge around HIV. So there's been good engagement of Morehouse. So definitely have seen a number of different models come out of Morehouse. Create a workforce of people living with HIV in the epidemic work. Absolutely. And really, that's been a lot of the work that the Southern Black Policy and Advocacy Network has been engaged in. How do you engage people living with HIV, particularly Black community leaders in the South, around the work? Because so often, and please comment if this experience has happened to others, is that we bring people in, we want them to disclose, we put them on the stage to disclose, but really do not provide the skills that are needed to continue long-term engagement in the work. So how do we, again, make sure that when building this workforce, we're not just getting people into the work, we're getting people into the work and getting them to operate at a level to where they can have long-term investment and impact in the work, if we're really talking about digging in for the long run and doing this work to help to reach these ambitious indicators within the next decade. What Trina say? Do we speak to our youth that are affected and acting out in a dangerous manner? Maybe you can say a little bit more about that. How do we speak to our youth that are affected and acting out in a dangerous manner? What do you mean when you say that? Going to another one, engagement with teen pregnancy groups, youth development programs, and focus on health and community educators. Trina Scott. Hey, Trina. All right. So, as we prepare to wrap up this conversation, hopefully we see that there's still a lot of work to really engage in this in the epidemic work and really bringing in Black communities in the South. And when we talk about Black communities, we're not just talking about Black communities who are consumers of HIV services, whether that be HIV testing or HIV treatment. We're talking about a meaningful engagement in people who are actually doing the work, how to make sure the resources are reaching the ground and reaching the individuals who are continuing to do this work. And when we talk about the workforce, we just can't stop with the elevation of Black community leaders as public health navigators or community outreach workers, which for many, that is a wonderful entry into this work. It was the way that I entered into this work, working as a volunteer for my local HIV organization. So definitely having those opportunities, but really finding ways for people to grow into this work, for people living with HIV to be able to continue to give meaningful impact and meaningful engagement around this work. And hopefully, as we prepare for the conference calls that will take place with elected officials, that individuals continue to tell their stories and make sure that elected officials that are with us and those who we still need to convince that they are aware of the End the Epidemic plan, and that they are aware that there are draft plans that are being submitted that needs their impact. That they needs their input, and that also needs you as the community to give input into those plans. And hopefully we can use these opportunities that we are having with virtual meetings, virtual engagement, to really improve our engagement with individuals who have not always been at the table, but definitely needs to be at the table, and utilizing different technologies so that we can be innovative in our approach to this work, and innovative in our approaches for reaching people on the ground. And so as prepare to wrap up, again, I wanted to share ways to get connected with the Southern Black Policy and Advocacy Network, our website, our email, and our social media platforms. Please go to our website and join our mailing list. We are preparing to activate our Southern Black HIV/AIDS Network Advisory Council, as well as really increasing our membership of the Southern Black HIV/AIDS Network. So if you're interested in finding out more about the Southern Black HIV/AIDS Network, please reach out and join us on our mailing list, and be on the lookout for some updates coming out very soon. Thank you so much for the rich dialogue that has been created in this conversation. Hopefully, if you continue connect with our social media networks, we are sharing other initiatives and other conversations that are going on. We know that the Black AIDS Institute is having conversations. There's an effort, United We Rise, are having conversations, Thrive SS, He is Valuable, a number of different organizations. And so if you are doing work in the South to mobilize Black communities, please feel free to share your organization and any handles that you may have, so that people can continue to be connected in the work. And again, thank you so much to AIDS United for continuing to host AIDSWatch 2020, and looking forward to continuing to do the work. And it's so good to see so many who are continuing this work even in the midst of COVID-19. And with that, I will end and say thank you so much for this opportunity to speak with you this afternoon.
Thanks so much, Fenton. Our next set of sessions will start at 4 o'clock, so hopefully folks will still be able to join us then. And until then, enjoy the break.